Good day, folks. This is Shahid Naseem once again in your care. And with disorders care, we're going to talk about occupational therapy. This is our topic today's, and here are some one-liners what we're going to discuss about today. What is occupational therapy, and what exactly it is, and what do OTs? We call them occupational therapists. What do they do? What to expect if you are going for that, and occupational therapy versus physical therapy. So we're going to talk about all these things, and among all other things, there is another very interesting technology. We call it assistive technology. So we are also going to talk about this assistive technology and how does it relate with occupational therapy or physical therapy, and what exactly is the difference between physical therapy and occupational therapy. Because I've been with quite a lot of people who confuses these two therapies with each other. They think that occupational therapy is also a physical therapy, but they are two different kind of therapies. So without any further ado, let's start with occupational therapy. What exactly is occupational therapy? Now, occupational therapists focus on enabling people to do what they want and need to do in their everyday lives. Some people use the abbreviation OT for occupational therapy. I told you this when I started this video, and today's video we're going to explain to you what occupational therapy is and what occupational therapists do, and what to expect during an appointment with one of these professionals. First things first, occupational therapy. It's a healthcare profession in which it focuses on helping people do all the things that they want and need to do in their daily life. So thing is that you need to understand that occupational therapy is more aligned with the daily routine life. So its purpose, its focus is to make you more independent. It make you more so you can live your life on your own without any assistance or help from anybody else, and to make you more empowered throughout your life. If for some reason you can't do all the daily things, for example, if you had a stroke, or if you've been to an accident, or if you have a disability, maybe a limb or something like that. So if you are facing some kind of difficulties in doing your daily chores or daily routine life, it could be as simple as bathing, or just cooking a meal for yourself. So basically the whole purpose and focus of occupational therapy is to make you independent, make you do all these daily activities on your own without any assistance from somebody else. So this includes work, school, hobbies, social situations, and mainly household tasks. A doctor might refer someone to an occupational therapist if they have acquired a disability, if they are recovering from a medical event such as a stroke, or have had an operation. By helping people carry out their daily activities, occupational therapy aims to promote health and improve your quality of life. Occupational therapists work to help people develop, recover, and improve while maintaining the skills that they need to live their lives. What do occupational therapists do? Usually people ask these kind of questions, that what are OTs and what exactly their job is, and if they're going to these medical professionals, and how can they know that if the medical professional is doing his job properly. So it's very important for you to know that what exactly they do. Occupational therapists offer practical advice and support to help people carry out their daily activities. Their work centers on adapting a person's environment so that it better suits them and the need and the things they want and need to do. OTs work with lots of people of all ages. Common example of what they do include helping people going through physical changes to carry on working, helping people experiencing changes in how they think or remember things to carry on working, helping children with disabilities fully participate in school, helping people with disabilities take part in social situation, hobbies, or supports. This becomes very helpful, especially in cases where people lose a limb or two. If somebody unfortunately loses his hand or his legs in an accident or in some kind of an operation, or we have seen cases like these where people lose their legs because of diabetics, or if people have lose their legs because of an accident. maybe a motor car accident or motor vehicle accident, they lose their legs. And but that is not the difficult part. Losing the leg was obviously it's a devastating event for anybody, but after the real deal comes after that, after that operation, after they survive the accident, after they come out of the hospital, then the real test begins. And occupational therapy helps you go through all those changes, which which could be devastating for anybody who has gone through these kind of events. People are usually who has two legs, who's physical fit, they are more prone to standing up on their own, they are more prone to go do their task on this on with themselves. But when something like this happens, the life completely change, and more than physical change, they need more than that, not just a physical assistance. So basically they help with these kind of things. So helping children with disabilities fully participate in school after, if the disability wasn't at birth and it came later on, or the severity came at the later age, so they help children with this. Helping people with disabilities take part in social situation, hobbies or sports. According to American Occupational Therapy Association, therapists will work with the person and their family to identify their goals, design a custom intervention or plan that will help the person perform their everyday activities and reach their goals. Check to see whether the person is meeting their goals and make any necessary changes to the plan. About half of the OTs in the United States work in specialist centers or hospitals. The others work in schools, nursing homes, and health services. Most occupational therapists will have a master's degree in the subject, and all must receive a license to operate. So you should know that if your medical professional has a license for it or not. What to expect when you go to a occupational therapist? During an occupational therapy appointment, the OT will want to evaluate the person's abilities and goals. How they do this will very much depend on the person and their needs. So it will vary from one age to another age, or from one person to another person. A child's need and goals obviously will be different from an adult's point of view. An adult's goals and wants will be completely different from an older age person. If somebody is older, the task and the goals that he has in his mind will be completely different from a guy who is young and who has who wants to do things differently. So the OT might also evaluate the person's home, school or workplace to see whether they can spot any ways to improve them. For example, they may suggest labeling the kitchen cabinets of older people with memory loss, or installing a handrail in the bathroom for people who find it hard to move around. As I've told you, that obviously for older people there will be a lot more challenges than younger people. For instance, washroom, these kind of things, if they want to go to washroom, they might need physical help from somebody else, and if somebody is not around, they should have a system that can support them. Once the OT has a clear idea of the person's circumstances and goals, they will use that information to develop a treatment plan, and they may recommend special equipment such as eating aids or a wheelchair, and help people learn to use it. And the OT will usually assesses the person's progress after a few weeks or months. They will ask how the person is doing in terms of achieving their goals, and they may also suggest changes to the treatment plan at this stage, obviously if necessary. And as I told you, they may recommend special equipment such as eating aids or a wheelchair and help people learn how to use it. When we talk about wheelchairs and other assistive technology, hence the topic that I was referring to you in the start, that is a very interesting topic, assistive technology. And for the last decade, man has some remarkable growth in this area, not just for the people who are disabled or who are facing these kind of disabilities, but in general scale. It has completely changed the term. Usually the term was known as assistive technology, and the definition goes like this: assistive technology as an umbrella term covering the systems and services related to the delivery of assistive products and services. In traditional definition, these services have been thought of as a device to enhance the daily living for persons with disabilities. Devices of this nature include wheelchairs, hearing aids, communication aids and prosthetic limbs. But the application of assistive tech has been broader over the years and now includes items like smart home technology, which has implications for the entire population. Closely related terms that may fall what you call that under the umbrella of assistive technology include adaptive equipment, smart home technology, home modifications, and aging in place supports. Why assistive technology is important? Assistive technology is important because it can enable people with disabilities to participate in all aspects of society and lead more independent lives. These technologies can help people with disabilities to perform daily activities such as communicating with others, moving around the environment, and accessing information. Assistive technology can have broader societal benefits, such as reducing healthcare costs, increasing productivity, promoting inclusivity, and reducing the stigma associated with disability. The need for assistive tech device is already massive, and it is set to double. Global, more than 1 billion people need one or more assistive products. Around 2 billion people will need at least one assistive product by 2030. The stats tell us this. Unfortunately, even though the need is massive, the majority of people do not have the access to the assistive products they need. WHO estimates that only 1 in 10 people in need to have access in need to have these assistive technologies have the access to assistive products. I will come later to the types of assistive technology with examples. I will tell you some other things. Let's go back to the original topic, and that was occupational therapy. And as I've told you that your occupational therapist may recommend special equipment such as eating aids or hearing aids, or if you are having some other problems according to your problem, they might suggest you some assistive technology. Occupational therapy versus physical therapy. This is the problem that usually people face, and this problem happens when people confuses occupational therapy with physical therapy. People often confuse occupational therapy and physical therapy because specialists in both areas work with similar groups of people and offer practical support. However, these types of therapies are different. Occupational therapy focuses on improving people's ability to perform the task that they need to do in their everyday life. Physical therapy, however, is different because it focuses on helping people improve their movement. So if I have to put it simply for you, occupational therapy is to help you make you independent in your daily life, and so you can do the little task that you want to do and that you need to do. So it focuses and it's directed towards your independence and your ability to do all the things that you need to do and you want to do yourself. And physical therapy is more like it focuses on helping people improve their physical movements, so they can physically move their muscles, and if they had a stroke and if they one side of their body is not moving, so the aim of the physical therapy is to make the movements better around your body, and to also to manage pain if you are in some kind of a physical pain. So physical therapy also focuses on this part to manage your pain. Physical therapists are movement experts who improve quality of life for people with specific movement dysfunctions. They do this through prescribed specific exercises, providing hands-on care, educating people on the affected area of their body. After making a diagnosis, PTs create personalized plans that help people improve their mobility, such as for those with stiff joints or muscles, and manage pain and other chronic conditions such as persistent back pain, recover from injury or surgery, and prevent further injuries. Both OTs and PTs work with the people on an individual level and develop plans to help them achieve their targets. However, while an OT, the occupational therapist, will focus on the person's goal relating to carry out their everyday activities, a physical therapy, which we call PT, a physical therapist will concentrate on the person's movement goals. I hope you understand this point. An OT will focus on the person's goals relating to carry out their everyday activities, and a therapist, physical therapist, will concentrate on the person's movement goals. An OT will usually recommend specialist equipment or suggest different ways of doing things that might help a person perform their necessary tasks. Whereas physical therapists tend to prescribe a course of exercises to help improve the way the person moves. So that's how these two things are different. Occupational therapy is, let's summarize everything here. Occupational therapy is a healthcare profession that focuses on enabling people to do the things they want and need to do in their everyday lives. While OTs work with people who are experiencing illness or disability or are recovering from a medical event such as a stroke or an operation, the OT will work with the person to understand their abilities and goals, then develop a treatment plan based on that information. They may recommend methods and equipment that will help the person carry out these activities. Occupational therapists help people adapt their environment to meet their needs. It is different than physical therapy, which helps people improve their movement. So the main focus of occupational therapy is to make your everyday life easy and to make you more independent, so you can do all the chores that you want to do and that you need to do. If you have to go to the washroom, if you have to go to school or your workplace, so make you understand and make you feel helpful to others and especially to yourself. So the main focus and main purpose and goal of occupational therapy is to make you independent in your daily life, so you can do all your daily activities by yourself. And while talking about this, once again let me remind you that physical therapy is not occupational therapy. In physical therapy we focus more on your movement skills, so make the movement better and better and better. Coming back to the assistive technology part, I've told you that I'm going to talk about the types of assistive technology with examples, obviously. Now that you know that what is assistive technology is and why it is so important, let's take a look at types of assistive technology and some specific example. Low-tech assistive technology. Low-tech assistive technology refers to simple and inexpensive devices, tools or strategies that can assist people with disabilities in performing daily activities. Now a very simple example of assistive technology could be eyeglasses. Well, in America we call them eyeglasses, but usually they are just glasses, but still glasses. They could be just a very simplistic explanation of assistive technology. About low tech assistive technology, bump dots, reachers, weighted pens, faucet extenders, these could be low tech assistive technology, and it can be particularly beneficial for people who may not have access to more complex or expensive technologies, or for those who only require minimal assistance. These devices can also be helpful for individuals who prefer to use less complex solutions to meet their needs, or who may have difficulty in learning to use more advanced technologies. High-tech assistive technology. High-tech assistive technology refers to the use of advanced and sophisticated devices, software and equipment that help individuals with disabilities or impairments to perform everyday tasks and activities. These technologies can include anything from computer software, specialized communication devices, advanced prosthetic and robotics. One of the examples that came into my mind about high-tech assistive technology is Stephen Hawking. If you remember the great scientist of all times, one of the great scientists, I mean the brilliant mind and the work he has done about string theory and black holes, it's simply remarkable. Stephen Hawking, as you all know, that he was going through this specific condition that won't allow him to move any part of his body. So he was on a wheelchair, a very specially designed wheelchair for him, and where this computerized voice comes whenever he want to say something or do something. Now this was a very specific kind of a wheelchair, a specific kind of assist software that helps him communicate with other people and help him research and help him write books and everything. So someday we are going to talk about we're going to make a video about how he excels in life, and with all these limitations that were thrown out to him by whatever the universe out there is, it was thrown to him, and the way he responded to all these difficulties and these complications and these everything, that's simply remarkable. Okay, we're going to talk about that in another video someday. High-tech assistive technology often involves the use of computer-based systems which can be customized to meet the specific needs. As I told you, that a specific example of that is a wheelchair of Stephen Hawking. Assistive technology or the visually impaired. Assistive technology for low vision is crucial because when vision gets low enough, your standard handled magnifiers just can't do enough. The tricky part is the stronger the level of magnification on handheld magnifier, the smaller the lens has to be. So at a certain level, it becomes more effective to use digital magnification or avoid relying on vision altogether. Assistive technology enables individuals to maintain as much independence and ability to engage in their desired occupations, even if it just for pleasure. Some examples of assistive technology for low vision: magnifiers. These low tech devices enlarge text images or subject to make them easier to see. We use them in, or we have seen these kind of things in cartoons when some detective is trying to see something. Screen readers. These software programs read text on a computer or mobile device out loud to the user. They can also provide audio feedback for other actions on the device, such as clicking on a button, etc. Electronic magnifiers. These are handheld or desktop devices that can use cameras and screens to magnify text or objects. They often have features like adjustable contrast or lighting to make the image clearer. Braille displays, a really good one. These are devices that convert digital text into braille characters that can be read by touch. They can be used with computers or mobile devices and are useful for people who are blind or have severe low vision. Voice activated assistants. These devices like Amazon Alexa or Google Home can be controlled with voice commands and can perform a task like playing music, setting reminders, and providing information. Talking watches and clocks. These devices announces the time audibly, making it easier for people with low vision to keep track of time. Color identification devices. These devices can identify and announce the color of object, which can be useful for people with color blindness or difficulty distinguishing between colors. Assistive technology for the hearing impaired. This includes hearing aids, cochlear implants, visual doorbells, closed captioning software, speech to text tools. Closed captioning software, when we talk about it, closed captioning software can provide text captions to spoken dialogue on television, videos, and other media. Speech to text tools, it includes speech to text tools can transcribe spoken words into written text, allowing people with hearing impairments to read what others are saying, and it can be as simple as using built-in features like the microphone button on a keyboard or on cell phone, etc. Vibrating alarms. While one might get a great night's sleep by taking out hearing aids, it also means they likely won't hear the alarm clock, phone, or smoke detector. Vibrating alarm systems like these can ensure important alerts are received in tactical way. Assistive technology for aging in place. Low-tech options, international lighting, creating a reading home base where the lighting is optimal for doing the hardest vision, what you call a task like reading in newspaper. Use the light bulbs with at least 5000 K on the color temperature and direct the light as the reading material. So these intentional lighting, they are really helpful. Mobility related devices, they are also a good example of it. Home modification, things like offset high hinges, grab bars, lever handles, and pull down shelves, etc., etc. High-tech options include smart home technology using a hub like Google Home or Amazon Alexa Show, etc. Medication management. It also includes a personal emergency response system, and it also includes a remote monitoring system. Funding for assistive technology. Many times assistive technology ends up being paid for out of pocket, which explains the numbers above about the massive disconnection between need and accesses. But are also several avenues for funding. You can fund on those avenues for assistive technology. So I think this is it from today's videos. We've talked about how these assistive technologies are helpful and how they are related with occupational therapy or physical therapy. You need these kind of things in life. So thank you so much for being with us. If you need any kind of information regarding these topics or any other topic, do get in touch with us, or do let us know what you think about these videos. Take care. Bye bye.